Coming up on Mayo Clinic Q&A.
It's like drinking from a fire hydrant of information. It can be really confusing, particularly if you're getting information from all different sources. So people often will get news really from social media. That's probably the worst way to get your news. You get a mix of valid information and opinion, and frankly, propaganda.
Finding credible information about COVID-19, vaccines, and the spread of variants can be a difficult task. Today on Mayo Clinic Q&A, we'll offer tips on how you can find trusted sources and help you separate fact from fiction.
If you're going to a website or vetting something that you've seen in social media, there are some tips that you can incorporate. Is this coming from a trusted site? Is this something that seems out of left field? Is this discordant from what you've been hearing from public health authorities? Can you run this by your doctor or provider? Your own provider is a trusted source of information.
Welcome everyone to Mayo Clinic Q&A. I'm your host, Dr. Helena Gazelka. The information about COVID-19 changes rapidly, and it can be very difficult to keep up. The internet is a great source of information, but the opposite is true too. So how do you know if the information that you're looking at is reliable and accurate? Here with us to offer simple tips is Dr. Melanie Swift. She's a Mayo Clinic preventative medicine specialist. Thanks for being here today, Melanie.
Thanks for having me, Helena.
Well, I have to say this is a really pertinent topic, and it has been for the past 2 years while we've been dealing with this. But I have never seen so much information on a topic as on COVID-19, and it seems to change almost hourly or daily for sure. So how do people know that they're getting reliable information?
Yeah, you're absolutely right. It's like drinking from a fire hydrant of information. And so it can be really confusing, particularly if you're getting information from all different sources. So people often will get news really from social media. And that's probably the worst way to get your news, honestly, because you get a mix of valid information and opinion and frankly, propaganda. So so online, there are some places that you can reliably go and get information that you can trust. So the CDC is one site that obviously has lots of information about COVID-19. When things change, guidance changes, that's the first place that guidance change is going to happen. So that's a trusted source. Healthcare institutions like the Mayo Clinic and other academic medical centers will maintain websites that have trusted, vetted information that medical experts have reviewed. There are also some organizations like the American Medical Association or the International or the Infectious Diseases Society of America, IDSA. So those professional medical organizations will put information on their website that you can trust.
And is that information in simple terms that anyone can understand or not necessarily?
Yeah, no, they actually do have patient-facing education on those sites that are really intended for the general public. Yes, there will be some other information that's targeted to their physician members, but patients are able to go there and get information they can digest as well. Yeah.
So those are some good sources that people can look at, but what sort of information should people be leery of? And what are the warning signs that information may not be credible?
There are a lot of organizations that are putting information out there, and the organization may have a name that sounds reasonable, but in fact is a front for just someone's personal opinion, or perhaps some group that's got an agenda, a political or otherwise. So when going to a site like that, first of all, if you've never heard of this organization before, be a little bit wary. There should be an About Us tab on that website where you can click and learn more about the organization, who's behind it, who funds it, do they have a board, and who's on that board. So you want to be sure that if you're going to an organization that's putting out information, that it's a nonprofit, that they're transparent about who's running the site, and who the leaders of the organization are and what their credentials are.
Melanie, you wrote a piece about misinformation and how individuals might identify it and avoid it. Would you run us through your tips that you provided?
Sure. So this sort of the sniff test, I call it. If you're going to a website or vetting something through social that you've seen in social media, there's some tips that you can sort of incorporate to ask yourself a little sort of checklist. So first of all, is this coming from a trusted site like CDC? So that's good. Second is this something that seems out of left field? Is this discordant from what you've been hearing from public health authorities, from CDC? Can you run this by your doctor or provider? Because your own provider is a trusted source of information, and can help you vet this kind of information. So does it seem to be making a claim that is miraculous, or that is, flying in the face of what other trusted sources are saying? So those are all really red flags that this probably is not a claim that you want to promote or believe. You can also type the claim into a Google search, and you will often find that it's already been refuted. You can find that, it's already been investigated, found to be a false claim, or is part of a misinformation campaign that way.
Melanie, I have found that even as a physician, I have difficulty sifting through all of the information that is available on COVID-19, and I rely on experts such as yourself to help be aware of what's in the medical literature that actually is valid and reliable data. So I can only imagine it's very difficult for everyone to sift through. Now, how do individuals protect themselves and protect from sharing information that may or may not be credible? I think that sometimes things are propagated because people keep putting them on social media or other venues. What do you think about that?
Yeah, absolutely. Sometimes when people say they've done research, what they've done is actually just an internet search looking for something that supports what they want to say. So just because someone says, I have done my research and I learned this fact, do not believe that that's a vetted fact. All those tips that we just talked about are good things to do to check it out. But ultimately, sometimes you just can't determine if what they're saying is true or not. So the bottom line is, if you're not sure, don't share it. Especially if it's something that's counter to public health advice right now, because there is a lot of misinformation. Unfortunately, some of it is intentional, but a lot of it is also just well-meaning people who've heard something that sounds like it's important. They may not have vetted it to see if it's true, but they share it because it sounds very interesting. And that's the kind of thing that can kind of go viral within a social network, and then other people start to believe it. So if you're not sure, don't share.
Those are great tips, Melanie. And I think this is important for topics other than COVID-19 too. As a physician, I often have patients bring in information and they'll ask me, well, I read about this. And so I will either look into it, or I will already know the medical literature because it's in a topic that is in my expertise, and be able to share that with them. So I think these tips are terrific. Thank you for sharing with us today.
I'm glad you mentioned expertise. Could I add one other thing?
Yes, please.
information about COVID-19 that's coming from medical experts will typically be coming from an expert who's trained in the field. So they're either trained in infectious diseases or pulmonary medicine or public health or preventive medicine, but probably not from a field that's completely unrelated. So if someone's training was in, say, gastroenterology or cardiology or something else, and they're espousing some views and opinions about COVID-19 or the COVID vaccines that is counter to public health, you need to be very suspicious of that, because really the authoritative voice on those issues are coming from people that were trained in that specialty.
That's a great point. Thank you for being here today, Melanie.
Thank you for having me.
Our thanks to Dr. Melanie Swift, Preventative Medicine Specialist at Mayo Clinic, for being here today to talk to us about where should we get information on COVID-19 and how do we know if we can trust it. I hope that you learned something. I know that I did. We wish each of you a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.